Placing dental implants is a very simple procedure that is a very high success rate, and people often do not have very many complications with it. However, there are some disasters that I've seen occur. The person who may be placing the implants might not have the knowledge for all the different factors that come into play with the long-term success of implants. Whenever a dental implant is placed, the whole plan for where that implant should be placed should be based on where the tooth needs to be in the end. So a lot of times, somebody who doesn't have a lot of experience with the restorative side of it, although they may be a fantastic surgeon, might not have the knowledge of where that implant should be placed. And what I see a lot is the implants may not even be restorable, even though from a surgical perspective, they were placed very well and they've healed very well, but now you've got an implant that can't be restored. A good question to ask the doctor would be, are you the person who's going to be restoring this implant? Starting with the end in mind is always critical, and not everyone does that. If you were to have an implant done in an office, there should be some type of guarantee that they have the knowledge and the technology to deal with complications that could arise. Let's say somebody has a traumatic event that breaks a bridge on top of their implant. How are you going to deal with that if you don't have the lab on site to repair it, to make a new one for the patient, so they don't have to go without having teeth? Sometimes the earliest signs of an implant failing, the patient might not notice, but it can be bleeding around the implant, which may be a metallic taste that the patient notices. The safest way to ensure that we catch these problems early on, when they're more successfully treated, is to do regular maintenance, getting the implants cleaned and checked regularly, just like you would with the natural teeth. Failure of implants always comes down to how soon we catch it. The longer it goes, the worse the prognosis is. So early on, sometimes we can use lasers to disinfect the surface of the implant. If that implant has been infected for a long time, it may have even destroyed the jawbone to the point where bone grafting or tissue grafting might be needed to reconstruct the jaw. If you have a failing implant, please don't hesitate to call our office or go to our website and schedule a free consultation. The longer you wait and put it off, the prognosis gets worse and worse. So please don't hesitate to call so we can restore your smile.